So welcome to this episode with me, Martin Franzen, that runs Wellage in Old Town, Stockholm. And with me today, I have a dear friend and colleague, Dr. Yannick Pauli in Lausanne, Switzerland. I've had you over here as well teaching, and it was a great seminar because you are so well worth to learn from as a chiropractor and a colleague, but also now during this hour from the general public to learn as well about that full model that is starting to develop today, where not only chiropractors like us, but others start to integrate more and more about functional neurology, functional medicine, which you are an expert within the field. And especially, I know that you work a lot with non-drug approaches, not a non-Ritalin solution for kids on the spectrum, which we're going to touch base on today as well. Because so many people don't know that whether they are grown-ups or whether they have kids that are on the spectrum, that they can actually seek a chiropractor that are trained in functional neurology and functional medicine to get assistance to resolve this without the need of medications many times. So
absolutely. Well, thanks for having me, Martin. It's always a pleasure to connect with you. We've known each other for quite a long time and being able to touch base from time to time. So it's always a pleasure. I think we should start because some people will probably, wonder, well, what's the spectrum we're talking about? So really, the spectrum, when we talk about children, I call that the disconnected brain. It's been inspired by one of our mentors, Dr. Robert Melillo, who has written books on what he calls disconnected kids. And it's really, that soup of letters that we put on children and adults, behavioral and mental issues such as ADD, ADHD, dyslexia, dysorthographia, dyscalculia, dyspraxia, which is coordination issues, and then the whole, autism spectrum disorders. And then you can throw in there, obsessive compulsive disorders and anxiety and depression. So, at first sight, a lot of people, they know that the medical model has some limits. So a lot of people are seeking alternatives, right, to help with these issues. And what's fascinating is that people don't really consider chiropractic as part of the solution. Obviously not the only thing, right? It's a teamwork effort.
yes.
But there was an interesting study that was done in Australia a few years back, where they asked parents what type of alternatives they were using and to evaluate the efficacy of those alternatives. And so there were some common ones, omega-3s, diet and things like that. And chiropractic was really at the bottom of the list. Only about 10% of people had used it in relationship to those disorders, but it came out as the most effective in the view of, of the parents. Which is very interesting. So it was one of the least known, but when people use it, it was the one that was really discussed as being one of the most efficacious. And today, excuse me, what I want to do is present what I call the 7D model. Is really if you have a child or yourself on that spectrum of issues, I want you to really understand what is going on in your brain. And we're going to tie it back to how chiropractic can help. So I think, probably the best way to start, Martin, is to really differentiate, the medical model as it is used today and the model of a functional approach. So in medicine, basically, if you take those disorders, they will diagnose you based on cluster of symptoms. So, for example, if you have mainly inattention and hyperactivity, you're gonna get, diagnosis of ADHD. If you have more social integration and communication issues, they're gonna put you on the autistic spectrum disorders. If you have, reading issues, you're gonna be labeled as dyslexia. But there's a lot of controversies over those disorders, and even like the reliability of some of the questionnaires that they use is not 100%. So if we take an example, for example, ADHD, there's some scales that are used to diagnose, and you have, some symptoms on the inattention side and some symptoms on the hyperactive impulsive sides. There's 9 criteria, and if you say yes to 6 of those, then we can put the medical diagnosis and put you on mind-altering medication. Now, here's an interesting question. What about if you have 5 out of 9? You don't have a disorder. But then suddenly, if you have 6 yeses, which is an evaluation from the outside, then suddenly you have this so-called mental disorder, right?
Yeah.
And now that begs another thing, is that if you're 6 out of 9, and I bring you from 6 to 5 with my treatment, have I cured you from the disorder?
Yeah.
And I would say someone that has 5 criteria out of 6 is not diagnosed, but in their daily lives, they're still going to have a lot of issues, right? Yeah. Compared to someone that's 6. So there's a lot of issues related to the diagnosis. And then obviously there's the approach in medicine is essentially based on either medications or psychotherapy or both. And that's a model that's reliant on basically a model that dates from the 1950s that says in ADHD, for example, you have a deficiency in dopamine, so we need to boost dopamine in your brain with those medications. The idea here is that really what's happening is, problems in the prefrontal cortex that act as a brake for the rest of the brain. Yeah. So those medications, they're actually stimulants. And some parents may wonder, well, why do we give stimulants to someone that's already hyperactive, right? Well, what it does, it will boost, the brake mechanism. Yeah. It would stop the engine, if you want. So a good metaphor to understand like an hyperactive child is like having a Ferrari and poor brakes, like you have a really strong engine, but poor brakes. And the problem with a lot of this medication is that if you look in the science, they're really effective in the short term to calm down the symptoms, to control the symptoms, but there are very few studies on their impact on long-term benefits. Actually, some of the longest, duration studies, which is called the MTA, it shows that whatever you do after 2 or 3 years, there's no difference. So, whether you medicate your child or whether you go with psychotherapy, at the beginning, children will, do better with the medication, but over 2 or 3 years, it really doesn't matter. So there's a lot of limits to medicine. It has its place. I mean, there's definitely, I've worked with more than 1,000 families, and there are some children that we have limited results with, because I think some of them have more of a genetic components and more of biochemical. And in that sense, nothing beats some of these medications, for symptoms control. But for sure, it doesn't go at the root cause of the problem. Yeah. It mitigates symptoms in the short run, but when you stop, then you're back to square one, right? And very often what happens is that they need to improve the dose, over time, to a point where then it doesn't work, so they have to change medications. So there's a lot of issues, and obviously as parents, you want, if you can't, you want to find other solutions that are long-term solution for your child, not to medicate, and that's normal. So really, the model that we have developed is trying to understand, okay, what's going on underneath those disorders, because there's really and even in science now, a move towards what they call transdiagnostic approach, which is instead of diagnosing children based on, symptoms, to try to understand what is going on in their brain. Yeah. And what these studies show is that there is really different path, meaning that when you have ADHD, there are different neurological imbalances in your brain that can bring to that. Some of them are related to prefrontal cortex, some other are related to working memories issues. It's even more obvious in dyslexia, where if you look at the science, there are different theories as to what is going on neurologically in the dyslexic brain. Some show that it's issues with part of the brain that help to decipher phonemes, which is, the sounds of the words. Some have shown there's like dysfunctional visual pathways. Some other theories about the cerebellum dysfunctioning. And what's really interesting is that each researcher is like, well, my theory is the correct one. And when they publish studies, they go all about all the supportive evidence for there. And, and very few have this idea that, well, maybe they're all true, and some children have more. And there's actually lately a study that was done on that where they actually tested for everything. And they've shown actually there's different profiles, some children, they have more of this, some other more of that, some it's like a little bit of the three. So really, and there's a lot of things that can help, right? For parents, this is what happens that, maybe their neighbor have an issue with their child and they try omega-3 and it really helps a lot. Yeah. So the parents now, they hear about that and they buy some omega-3s and they give it to their children and nothing happens because there's these different patterns. And really, a lot of people, there's a lot of therapies and everybody believes about their therapy. Yeah. And they apply the same therapy to everyone, right? So if you just happen to have like a visual-based therapy and you give it to a child that have a visual-based issue, then that's going to respond well. But then the next one maybe have an auditory issue and you apply your visually-based therapy and nothing happens, right? So I would say the magic in what we do, it's not about the therapy, because I haven't invented anything. It's more about the magic is in finding out what's going on specifically in the brain of that child and being able to target that specifically. So, any question on that or?
No, it's so true. I mean, this is our common outlook, to find out what is it that disturbs. And it might be one thing, or it might be multiple factors of things that is the underlying reason why these different symptoms are showing up. And it's so important to find out what is the underlying disturbance in the nervous system's function, in the brain's function, and how to support it in the best way possible that we can do to serve the person before us, whether it's kids on the spectra or grown-ups on the spectra. So, yeah.
And I think it's very important because, I mean, it's just good medicine in a sense, right? I'm just going to show one case. It's a bit of an extreme one, but it shows the importance of that. That young kid was called Johan, and he had been not doing well for about 2 years. His performance in school was degrading, a lot of fatigue, and couldn't concentrate. So he got diagnosed with ADHD. They put him on Ritalin. That didn't really change anything. So the pediatrician sent him to a psychologist or psychiatrist who actually diagnosed, confirmed the diagnosis, and then added that he had anxious disorder. So they added an anti-anxiety medication, and that still didn't change anything. And he started having kind of hallucination, like he felt little things crawling on his skin, which can be an effect from the Ritalin. So they sent him to this big university hospital guy, psychiatrist, and actually he confirmed the 2 previous diagnoses, and he said, well, he started having like a delusional issues. So they put him on a neuroleptic. So now he was on 3 drugs and still not progressing. And he comes to me and I look at the child, and the first thing that, I'm like, man, this child is sick. There's something in his eyes. It just tell you that there's really something. So I do my whole process and I don't find any of what I'm going to show here, which we call the 7 Ds. I don't find any of the dysfunction that we typically see in those developmental disorders. Okay. And the only thing that we see on a blood draw is that his CRP, which is a marker of inflammation, is really, really high. And he has a pattern of infection. And I'm like, whoa, that's weird. So I sent him getting more tests, and he has actually a parasitic infection, toxoplasmosis. Yeah. And some form of toxoplasmosis can go into your brain. And that's what the kid has. Yeah. So we sent him to an infectiologist, which prescribe a medication, just to show that, we're not against medications, but not like a mental altering medication, a medication for, the infection. And in about 3 weeks, complete change. And it took a few months, and then we supported him with, all the inflammation that had been going on with the anti-inflammatory diet and things like that. But in about 3 months, he was completely cured. So the thing is, like, he was diagnosed with a mental issue that had nothing to do with anything mental, And this is, so not every, it doesn't mean don't go on as interpreting, well, my kid might have a brain tumor now or infection. No, but if you just go with that symptomatic cluster, in their model, these people weren't wrong. It's just that they had such a limited view. And then when we pointed out to them, the errors, that they were, they didn't want to respond on anything, which is sad because it's really about the patient. So when we go into these models, to make it simple, there's really like two things you need to look at. You need to look at the brain as far as, the circuits in the brain, and you need to look at the metabolic side of things. So in the brain, there's really 7 Ds, and we'll see if it matches because it's 7 Ds in French. So we'll see if that translates to English. So the first D is really that the brain is delayed. Okay. If you look at the brain, it will develop according to a certain trajectory. As you grow, your brain will create a lot of neurons. Okay. And those neurons will make that the outer part of your brain, your cortex, will start to get thicker and thicker and thicker until about 12 to 14 years old, where it reaches the peak. And then from then on, the brain will get rid of a lot of neurons, about 60%. So here's the thing, adolescents have more brain cells than adults, right? Which makes it a little bit unbelievable. So it gets rid of all the neurons that it doesn't need, but then it will make better connections between the ones that are left over. So there's really a trajectory of development. So you have some children that have, for example, brain lesions or trisomy, for example. They have a totally altered brain development, okay? On the spectrum, it follows the same trajectory, but it reaches some of the milestones with a delay. And it's not the whole brain, it's usually part of the brain, and the parts that are delayed define the syndrome, if you want, or the diagnosis. But it's not altered, it's just slower or more sluggish in the development. And in ADHD studies, it's about 2 to 3 years, okay? So the first thing is, very often you have these children and we interact with them and we expect them to be their chronological age. Well, you're 10 years old, you should behave this way. And we forget that part of their brain, they're functioning maybe at 6 or 7 years of age. Okay, so that's a very important thing to remember. So that's the first D. And obviously that's, when I talk about the 7 Ds, that's commonalities in all of those disorders. Then there's specifics. For example, in autism, it produces even more, brain cells that it should. And then when it prunes, when it gets rid of them, it does so more slowly. So, and then there's also micro-architectural changes. I'm not going to go into the details, but there's, then there's specifics to those disorders also. But here I'm just talking in general. So the first D is delayed, okay? The second one is dephased. So there's kind of phases of development. And as you grow, there's priorities. In the first 3 years of life, your right side of the brain, your right hemisphere is more metabolically active. And the more metabolically active it is, the more susceptible it is to injury. And then it switches over and it's the left for about 2 or 3 years and it switches like that. And one of the things that we know in this children population is that there's asynchronous brain development.
Yes.
Meaning you have, one hemisphere that is doing well, maybe even a little bit earlier development, better than it should, and the other one is lagging behind. And this is very important for parents to understand because a lot of the time, they go and they get assessed and they're like, well, he's really good at reasoning, but then he can concentrate. So they have these asymmetries in function, and a lot of the parents and professionals, they scratch their heads like, well, how come he doesn't, he can't really perform because he's so smart at the same time. So it's really this model of asymmetry or asynchronous brain development is really at the core of this understanding, and that's a big one that we see in every children. And I don't know if you remember the film Rain Man,
Yeah,
with Dustin Hoffman and what was the guy from Top Gun there? I can't remember his name now. Famous
Tom Cruise.
Tom Cruise, yeah. So basically, the film is all about Charlie Babbitt, which is Tom Cruise. He's this very extravagant guy that discovered he has a brother. I think it was Ray or something, and he's autistic, right? And Ray is like unbelievable because I don't know if you remember that scenes where like there's matches that falls out of the box, and like he can instantly know how many there are. But then like he can't even button his shirt on his own, right? So it's really this asymmetry of function, and that's the extreme. But I think a lot of parents, at least our age or more, will relate to that. So that's a very important one, is this, asynchronous brain development. The third one is what I call decoordinated.
Yeah.
In our brain really is dependent on a good, how to say that, a good coordination of things. So it's really a role of the cerebellum to coordinate different things in the body. So for a long time in science, we know that, your cerebellum coordinates your movements. Well, now they found out that this cerebellum is actually not coordinating just movement, it's coordinating thoughts and emotion. And in science, we call that dysmetria. If your cerebellum is not doing its job, it's really this idea that you're a bit off. You're off like physically, you're clumsy physically, but you're also clumsy in your thoughts and in your emotions. And what's fascinating is that when they do brain imaging studies that compare children on the spectrum to neurotypically developing children, every study finds different parts, but there's one that pretty much all studies find. It's this really delay and immaturity in the development of the cerebellum, and especially one part of the center of the cerebellum, which we call the vermis. And I don't know if you remember your neurology, Martin. Yeah. I don't want to put you on the spot. Do you remember where the main information is coming from to this vermis?
The spine.
Spine and postural muscles. Okay. So it's very interesting that, one of the core dysfunction that we find in pretty much all the studies, it's that part of the brain that receives information from the spine and the postural muscle, and that can now start to clue people in as to why chiropractic can help, because when we adjust people, that's a tremendous amount of stimulation and information going into those parts, and that will help them stabilize. One thing that's fascinating is that they've done studies where they look at people, that have obviously immaturity in their cortex and prefrontal cortex, executive functions, between those that recover and those that don't. And what breaks it or not is how the cerebellum is actually recovering or not. If your cerebellum can recover, you're going to grow out of it. If your cerebellum doesn't, then you're not going to grow. So, it's really like almost a determinant, right? Now, the 4D is still related to the cerebellum, which I call dysrhythmic.
Yeah.
And you need to realize that every second, your brain needs to integrate about 11 million bits of information. Okay. That's a lot of information. And in order to integrate that, your brain has no spatial location. There's no single spot where it will, integrate all this information. So it will do that on a time basis, meaning if you have two information that gets at the same time into the system, it will bind them together and make an experience that is coherent out of it. Okay. So in order to do that, it needs to have a sense of time, a sense of timing, of rhythmicity. And again, it's given by the cerebellum. So the cerebellum is really, if you want, this almost like this orchestra conductor, right? Like all the musicians, they're professionals. They know how to play the music. They can play the piece. But then you have the conductor that comes and makes sure everything works in unity. Everything is coordinated, and it brings its own little emotional tone to it, right?
Mm.
So there's an added dimension. Well, that's what our cerebellum does. It helps integrate, make sure that all the other parts of the brain play a beautiful music instead of a like totally brouhaha, what's that? Okay. Now, this timing is given by the cerebellum, but there's also issues in other parts of the brain that can happen. I just want to give you an example. In dyslexia, one of the issues that's not functioning is that in our eye pathways, we have actually different pathways, which we call, one it's more related to where is the information coming from, and the others, what are the details of that information. It's called parvocellular and magnocellular pathway. And studies have found that in dyslexia, not all, but in some of them, the magnocellular pathway, it's sluggish. Like it's slower about 20 to 40 milliseconds, which is nothing, right? Like we're talking about 1/5 of a second. And yet that 1/5 of a second is what can be a lifetime of struggle for your child, So just show us how really timed and really calibrated the system needs to be to be able to express our beautiful humanity, right? So that's this other dimension. The fifth one is desynchronized. So far, so good, right? With the translation. When we talk about this asynchronous brain development, it's not just on the way it develops on a physical nature of the brain. Our brain communicates a lot through electromagnetic communication, right? So we need to be on the same wavelength. So here, if we had now we have Zoom to communicate, but let's say we go back a few years back and we have walkie-talkie, we would need to be on the same wavelength in order to be able to communicate. And that wavelength, there's obviously different ones in our brain, right? When you sleep, it's not the same as when you're alert or when you're relaxed. There's different paths. But at the basis of consciousness, there's this 40 hertz frequency that is actually given by some pacemaker cells in, part of cells that create circuits which we call thalamocortical circuits. And in science, they call that thalamocortical dysrhythmia, and it's been shown to happen in those spectrum disorders, schizophrenia, even chronic pain. So basically, you have this generator of those rhythms in your brain, and if you start having imbalances, then again the brain cannot truly communicate electromagnetically because it's not on the same wavelength. One of the metaphor I use, you hook up like a MacBook to an old Commodore 64,
Yes.
And that's not going to work very well. It bugs and it gives you a lot of things. So this thalamocortical dysrhythmia, which is really interesting, is that those thalamocortical neurons, they get a lot of input into the system. And when they cut the different connection, it works less well, but it still works. Except for one pathway, when they cut it, everything stops. And guess where it's coming from? Dorsal columns in your spinal cord, which again comes from your spine and your muscle. So again, we're like, our spine is really at the core of a lot of those mechanisms in the brain. So if it's not working well, your cerebellum is not going to work well, your thalamocortical neurons not going to work well, and then the rest of your brain is not going to integrate very well. Okay. The sixth one is called disconnected. And disconnected is really, it can be disconnected physically, and as I just mentioned, disconnected electromagnetically. And that's something that is very obvious, for example, in autism, where actually when your brain starts to develop, it starts creating connection first with very local neurons, and then with neurons that are further away. So for example, in autism, what happens that physically you start having over connections locally and less connections, distally or further away. Now, obviously, once the system develops this way, there's really nothing that you can do to regrow, right, things. But then what we can do is that we can use all the pathways to kind of calm down the ones that have too much connections, and then we can improve the connections of those ones, that are long range, what we call long range. We're not going to be able to make more neurons, but the neurons that are existent, we can make them more connected with them by working them out, right? And then the seventh one is what I call detuned. And if we go back to our orchestra, like imagine that you have, the wind instruments and you have the percussions. Now, let's say that they all do well, but you're listening in, the theater, and the microphones have issues where you have the one from the winds. It's like it's set up too much, so you hear them a lot. And the percussion, the microphone is turned down. So they're all playing well, but you hear one over the other. Yeah. And that's another thing where there's really too much activity in one part of the brain and not enough, in other parts. And those relates almost more to more specific issues. For example, but in ADHD, well, you're going to find parts that are too active. It's going to be different if it's purely ADD versus ADD plus hyperactivity or ADD with anxiety. And really the magic is in finding out, really those profiles. Because again, let's say you have a child that has a lot of issues where most of his issue with his cerebellum, and you go like here we call that psychomotricity. Those specialists that take care of children that have those issues, and they will work both sides of the body and with a lot of balance and movement exercise. So for that child, he might benefit a lot from this approach. And then you have the next child where his problem is mainly this asynchronous brain development. So they go to the same therapist and they do pretty much the same therapy. And now they still work on both sides of the body. And it's like, you injured your left biceps, and I give you 10 pounds to do that on both sides. Your good arm will grow. And this one, you might even injure it, right? Yeah. So they apply the same model, working on both sides, and the child doesn't progress, or sometimes even gets worse because we're not addressing the imbalance. And in that case, by working mainly on the imbalance, then you can start having good changes. So it's really a matter of identifying the profile of the child.
Exactly.
Yeah. So any questions or comments on that?
No. Brilliantly put. So
really, when we evaluate children,
according to research,
we go through a model, because this is well described in research. Now, what we try to do is translate that clinically. And so when we evaluate children, we go through evaluating different levels. Your brain develops almost like a house. You need foundations and you need the walls, and then you can put the roof, right? So if you don't have foundation, everything on top of that, and that's the issue, right? For example, we see children, they try, there's a few application out there. CogMed was really known for a while, where it trains, with brain games, brain rehab kind of things. It trains your executive functions. Well, that's good. It's like it's repairing the roof, right? But if at the same time you have no foundations and your wall are all like unstable, then it's not going to serve. So it's really important to address the child and to build upon what corresponds to their development. So when we evaluate them through 7 dimensions. It's, again, the nervous system doesn't make any difference. It's more for us to be able to organize our thought process. But we look at everything that's reflex-based, coming from spinal cord and brainstem. And then we go into physical fitness. Because what we need to realize that those children, when you talk about ADHD, it's based on 3 symptoms: inattention, hyperactivity, and impulsivity. Yeah. The reality, it's a whole experience.
Yeah.
They have issues with motor function, they have issues with balance, they have issues with ocular motor functions, they have issues with metabolic things, they have issues, and I don't even, mention how it translates into the daily life. Like I'm actually finishing a small book now, and the first chapters are the experience of parents and how it is, or families, and how it's affected. And I mean, those parents, they deserve a medal, and no one's never gonna give it to them. And there's a lot of shame and stigmatizations and things of that nature. Parents who don't have a child on the spectrum can't understand that, what it is to nurture a child with that. I mean, wow, it's like I have so much respect for you parents who have children on the spectrum. I mean, what you're doing, it's unbelievable for your children. So we need to consider all those dimensions. So so we go physical fitness, and then we look at what's going on in the cerebellum, and then we get a look at what's related to the mesencephalon and medulla, so brainstem. And then we look at what's going on in the higher up, receptive sensory brain, and then the executive brain. And we try to be as specific as possible. And sometimes, the child is very cooperative, and we can do a lot and be very precise. And sometimes, you have an autistic child that's totally all over the place and that cannot understand, the comments you want them to do, and you do your best, to start working with that. But the idea here is that there's hope beyond, what you've been proposed those days. So that's really for the first aspect. And then the second aspect is really the metabolic side of things. And obviously diet has a lot to do with it. I mean, that's a big one because that's big changes. There's, I don't know, like in Switzerland here, we have like, when they go in school, you evaluate it from 0 to 6. So how much is it in Sweden there when they evaluate children, or as far as marks?
E is then you pass. So the A, B, C, D, E, and then F is failed. So it's
Okay, so A is the best.
Yeah.
Yeah. Okay, so it's about, like in Switzerland, there's about 6 levels, right? Let's say. Well, for example, there's studies that show if you switch your child to a Mediterranean diet, within 6 months, his grades goes up by half a point. Okay, which is significant, right? Even if you don't do anything else. And then there's some diet that are very restrictive. For example, there's a group led by Pelser in Holland where they've shown that putting these children in this oligo antigenic diet, which is really like pears and rice and lamb, not much else. But in some group of children, especially on the very hyperactive side, hyperactive aggressive, it can reduce like 80% of symptoms in more than 60% of kids, which is huge, right? Like it was actually really interesting because in science we have this notion of effect between 0 and 1, and 1 is like when an intervention has a really strong effect. In that subgroup of children, the effect was superior to Ritalin. And one guy called Barclay, he's a very well-renowned researcher in the States on ADHD. He actually accused that team of fraud because he couldn't believe the results, because in his mindset, it's just chemistry and it's genetic, and all you can do is, stimulate it with medication. But in that subgroup of children, major changes. But then, what kind of life do you have if you can just eat lamb and pears and rice, right? So, but sometimes, to give a breath to a family that's overwhelmed, that can be necessary. So there's different diets you can use. One of the most common ones, the paleo diet. The first things you need to check is, gluten, casein. Obviously, there's a lot of publicity around sugar. And it plays a role, but in the science, not as much as we thought. And clinically, it's not the main one. It's definitely not the main one, but diet will be one. Then we need to look at what is going on with the gut, your microbiome and the gut-brain axis. It's more and more described. If you have imbalance in your gut, that will impact your brain. Stress is a big one. obviously, if you look at babies, they have like their heart rate is very, very high, right? And as the brain develops, it kind of dampens it down. And well, since they have delayed development, their kind of autonomic tone is higher. So there's a lot of stress issues that we need to deal with. Then we need to look at inflammation and immune system function. We need to look at toxicity. A lot of these children have toxicity. On the immune side, a lot of children have, like when we test them for them, a lot of them, especially on the autistic spectrum disorder, on the autism, it's about almost 80-90% of kids that already have antibodies to their brain tissues, meaning they have autoimmunity to the brain. And so that's, things we need to look at. So hormone imbalances are a bit rarer, but that can happen. So it's really an idea to have this thing. But I like, before we started, we had this discussion on the importance of inflammation. And I think that's going to be interesting, not just for those who have children on the spectrum, for everyone, is inflammation has a really bad rep, right? Because, in medicine, it's a bad thing, right? Nobody likes having inflammation. You have pain, you have edema, you can't do what you need to do. So we've developed this approach to inflammation where we try to stop it. And that's based on an old model that believed that inflammation has only one phase, where the body triggers it and then it kind of fades away on its own. Like if you set a fire and the fire consumed the wood, and after a while it goes. Well, we thought it was this way, so we developed anti-inflammatories medication, cortisones, biological agents to stop that inflammation. And about 30 years ago, there's some people in Harvard that discovered that's not the way at all how it's working, that inflammation has two phases, one initial phase and one phase what we call resolution or rhizoleomics. And without that rhizoleomics, your body can't heal. It needs to stop the inflammation. So you need the inflammation, and then you need to be able to stop it. And to do that, your inflammation needs to reach a certain point. So if you interfere with it, studies that show that taking NSAIDs medication will avoid you from having too much inflammation, but it will drive then a chronic inflammation because it interferes with the resolution. So that's a very important thing. And what's really fascinating is that the resolution is dependent on molecules that are derived from EPA and DHA, which are two substances that are from the family of omega-3s. And I don't know, you guys in Sweden probably eat more fish than we do here in Switzerland. But overall, like worldwide, it's about 98% of the population, which is really missing those omega-3s. I mean, if we look at our paleo ancestors, they were eating up to 7 to 10 grams of EPA DHA every day, depending on whether they were living on the coast or whether they were living in the mainland. And I think in the northern countries, it's about maybe a gram a day. In Japan, it's about 1.5. In Switzerland and United States, it's about 250 milligrams. So we're like 1/50th of what our ancestors used to consume. And to be able to trigger this resolution, you need about 3 grams. It's more complicated than that. It will be based on your metabolic, your weight, whether you have diabetes or whatever. There's a lot of factors that go in the equation to really fine-tune the dosage. The problem here, and it's probably the same for you guys, is that in Switzerland, you can sell omega-3s, but you have a limit to how much you can say. And usually based on the policies around it, you might have 500 milligrams in a caps, and they might tell you, take 1 caps, maybe 2. So people are taking that, and I would say better than nothing, but it's really having no physiological effect. They've done a lot of studies on the cardioprotective effects of omega-3s, and they found when they're about 800 to a gram, there's really nothing that happens. But when you start going to 3 grams, 4 grams, then you start seeing that it's preventing some of those cardiovascular consequences. So coming back to our spectrum, there's a really interesting study. They took children and they actually measured where they were at to give them an amount based on their needs. And when you look at all the studies that have been done on ADHD, for example, and omega-3s, there's really about 12% of kids that have a really good response, meaning reduction of more than 50%. So it's not a lot, 12%. But they show that we were talking about this effect is about 0.203, which is considered like a slight to moderate effect. When they look at studies that use the higher doses, 1 gram, 2 grams, the effect goes up to about 0.708. So like stronger effect. So again, you need a certain amount. So you could be giving your kids like omega-3 and you give them like 1 gram a day and nothing happens and you're throwing money for nothing. But what's really fascinating in that study is that some children, they had already good levels. And if you give them too much, their concentration was affected negatively. So this is why it's really, it's like, wow, should I spend $100 on a test for that? Aren't we all deficient? I should just take it. Well, sometimes. So for me, the more precise we can be, the more we can discover the profile, the better effect we can have on children and on patients in general. So it's really a kind of knowing the possibilities, almost a checklist of everything that you need to check, and then to run people through those and really come out with the profile that they have, because the more you can then choose like a tool for their specific needs, the better the results you're going to get. And as I mentioned, like I'm not attached to it. I'm not in a therapy church in particular. My world doesn't resolve around one specific therapy. Sometimes like therapists, like, we used to say when all you have is a hammer, every problem becomes a nail, right? Because, so a lot of therapies out there, they only have one thing. So they put everyone onto that one thing. And sometimes it's a good match by chance. They don't even know why. And most of the time it doesn't. So the magic is really in the diagnosis. And really what I find fascinating, Martin, and you've probably seen that, is that you have a lot of these people that work with the children, medical doctors, pediatrician, psychiatrists, psychometrician, whatever you call them in your area, and none of them evaluate the brain. They come up with their protocol. They might do a neuropsychological exam, right? But that is more looking like at the software of the brain rather than hardware. And no one does a neurodevelopmental exam, say, well, here's the missed milestone kind of things, right? So I find that fascinating that we have all these people that work with children that have brain developmental issues, but that don't evaluate the brain. And if you were to ask them what's going on in the brain of my child, they probably wouldn't be able to re-answer anything coherent, right? So, it's, in medicine, it's it's a genetic condition with a dopamine deficiency. And, then if there was only that, your medication would be revolutionary. And for some, it's like it makes a major change, don't get me wrong, but like there's so much that is missing to the big picture of things. So here's for the ramble. You haven't too much, right? But what I really want parents to understand is that, there are models that can give you a lot of hope. And obviously, we're not God. We cannot guarantee 100% success. There's many factors that are involved. But there's really a way to go about it that is organized and thought through and based on science, and chiropractors that have trained into this perspective. I think it's very good because we still have, in a sense, like, I know our profession is really proud in being in a natural setting. At least in Switzerland, we're part of the medical system, so we still have like a good understanding of traditional medicine. Some of those other alternatives, these people, I mean, they just know their things, right? And they don't. So we have this kind of middle role where, you know, we have a really holistic approach in how we approach the patient, but still yet we have good training, foundational training in the basics of medicine. And so we can really make a you know, a good link between those two worlds of the complementary and the traditional system. And I think for me, there's no doubt, not all chiropractors, because some of them, you know, are just focused on mechanics and it wouldn't make sense for them. I mean, they wouldn't even take patients, which is, you know, I respect them because they don't want to go beyond their kind of specialty. But having a chiropractor that has a neurological focus, you know, even if it maybe doesn't go into the depth that I explained today, is you should have that on your team, you know. And obviously, your chiropractor not gonna cure your child, you know, by itself, but it's a very, very important part of the team. Okay.
Yeah, for sure. Yeah, and I think, yeah, well put. I think the future for those chiropractic issues, but also in traditional medicine, there's more and more medical doctors that go into integrative medicine. That is so important. You know, having a functional understanding of the neurology that you learn, whether you're a chiropractor or an MD, but understanding it from a functional perspective, where small functional disturbances can have a huge impact on someone's life, whether now, as we discussed in this talk about being on the spectrum, but it can be so many other things that you're not performing at your peak state. So there's a huge support you can get from someone that has that evaluation of looking at the system from a functional perspective. And then the other one that you touched and gone through as well, the functional medicine, which is growing immensely. I mean, I know there's many medical doctors and other therapists in Sweden that getting training in functional medicine to have that understanding of what the research is actually saying, or the tests that you actually can take by labs, not always in the normal hospital setting. It might be other laboratories out in Europe that do those tests, but they are rigid, they are solid, they do evaluate aspects that are essential to find out in certain cases where they are, whether you're on the spectrum or not. And when you put those two together, integrative medicine, functional neurology, look at the brain first, and the functional medicine, then you get a very holistic approach. And when then you're in your toolbox, allow yourself to be flexible if you're willing to do that, and use all the senses, sensomotor stimulation, where, you know, we both use visual stimulation, colors, lasers, different kinds of sounds. There's so much within the field of just light, color therapy that you can integrate and get to learn by coming to someone like ourselves or others. There's so much within the field of just sound, what sound can do, specific sound, whether you stimulate from one side or another, and what hertz, what frequencies. There's so much research, and not only research, but the most important thing, things that have an impact on a person in improving their health from the inside out. Obviously, olfactory, we work with all kinds of scents. I work with essential oils here at Wellage. I know that you also, it's part of the functional neurology perspective. Certain scents have and more evocative, raising up, and so others have a more calming effect. Some stimulate more the left brain, some stimulate more the right brain. So you can work with them also from the detox way. There are what flavors, spices that you can avoid or use more of to affect the brain and to help the body to detox itself. And not at least, I would say that is obviously from our perspective, my biggest tool is obviously touch and movement, because as Dr. Yannick, as you touched on, that touch and movement are nutrition for the brain in its development. The only constant that is constant of all the senses that you are is always, if you're not out in space, is the gravitational field. That's always there. So if you get that right, and if you get sound, vision, smells, taste. You have a very healing approach to address the whole system and assisting the healing from the inside out instead of from only going from the outside.
Yeah. You know, and one thing that I really want to emphasize, Martin, before we started the call, you were talking to me about one of the technique that you use is where you pick up on the body.
Yeah.
You know, which kind of system, whether it's more the gut, whether it's more the stress system. Now, here's one thing. In functional medicine, it's a good progress. And yet it almost goes to an extreme now, especially since COVID, where, you know, these people will run a lot of tests, which will give you a lot of information.
Yeah.
And yet fewer and fewer of those practitioners do a clinical exams. Many of them work at distance. So they don't even treat people, they treat blood test results. So now let's imagine that, you know, and I say it's different between a machine gun approach where you test everything and I mean, you're going to find something, you know, if you test everything versus a sniper where you really try to use your test to confirm from the analysis and your exam. So now let's say we do a test on a patient, right? Yeah. And you have something in the gut that shows up and something in the stress system. Well, where do you start?
Yeah.
You know, now as a chiropractor, you have this information, you have your extra thing, your touch, and you go, it can be, you know, it can be kinesiology, there's different way of going about it, but then you go and you feel, and you're like, man, there's more dysfunction in that reflex point from the gut. Yeah. So now I have an added dimension that shows me, well, that might be the priority. And then you start working on that and you start feeling it reduce, this reflex point, if that's the way it works. I'm not an expert in that technique.
It's an inflammatory response in the tissue.
Yeah, so you can monitor the changes physiologically with something very simple that doesn't cost too much, and you don't have to redo the test regularly. And this is the thing. I had a patient. She had seen already like 3 different functional medicine practitioners. She has like a lot of chronic stuff. Never been, you know, evaluated physically by any of them. Yeah. One of them gave her 30 different supplements, meaning for every imbalance, he threw something at that stuff. Yeah. So it's like you're trying to bake a cake. You have all the ingredients and you put everything at once into that. You know, and that's not the way it works, right? For the recipe to work, you need to, I mean, if you forget the eggs and you cook it and then you try to add the eggs at the end, it's not gonna work. Yeah. So the thing is, you know, and sometimes like I have patients where they come with the cake and the eggs on top of it. And then what we do is we redo the same cake, except we just put the eggs right after, you know, I can't remember what you said in English, farine, you know, whatever you, when you know, what I want to say is that there's a sequence of things that needs to be done. And the clinical exam is really, really at the center of understanding these things. And the other thing that's really interesting is, now it's expanding, but for a long time in functional neurology, they were doing only functional neurology. So sometimes they were, you know, like imagine rehabilitating a brain where you don't have enough of the factor that are needed metabolically to create energy. You're fatiguing the brain even more. Try to, you know, I tell my patient, it's like, if you're completely inflamed, I try to rehab you. It's like if you're coming to me saying like, I have balance problems, and I try to give you balance exercises, but actually your issue is that you're drinking 1 liter of alcohol every day. You know, how far am I going to go rehabilitating your balance with exercise, right? So a lot of the functional neurology didn't take into consideration the metabolic, and on the functional medicine side, they don't take into account the brain. For example, we know that you get a concussion, it will impact through the gut-brain axis. It will make your gut leaky. Yeah. So now the gut is in functional medicine, really a lot of people put emphasis on the gut. Now you go there and they see that you have leaky gut, and they don't take a good history. They don't know you've had a concussion, and now they give you all the supplements for that leaky gut, and it doesn't heal. Yeah. Why? Because they haven't taken into account the top to bottom things. And for example, I see a lot of that with people that have SIBO, small bacterial overgrowth in their gut, and they've done all those things, the diet and the thing. I had a patient lately, 20 or 30 years, let's say 20 years of constipation, sent to me by a medical doctor that does a good job on functional medicine, and he did everything and still yet no change on his constipation, and we checked her, and there was a neurology. Your gut, there's the tube, but then there's the control, yeah, exactly. And a lot of people in medicine, they forget that. It's about the control, making sure your brain can control your organs and get proper information. And that's what we do as chiropractor. We ensure that proper communication. So, we did some functional neurology with her and reduce her stress level. And in about the first evaluation, we're about 30-40% better. I should say changes, because she went from constipated to major diarrhea, her body cleaning out. And then over 2 to 3 months started regulating, and now she's about 60-70% better. Yeah. So there's really, really important to have this neurological perspective of things, and to have this holistic approach. And unfortunately in functional medicine, which is already a progress, but a lot of people that they become focused. So it's like the Lyme specialist. So you go there and everybody has Lyme. Yeah. And then there's like the detox guy. So everything is a detox problem. And you go there and they start detoxing you, and they didn't realize that you had like an autoimmune issues going on, and that you're not only reacting to foods and toxins, but your body has lost oral tolerance and chemical tolerance. And they detox you. They take the toxins in your body, put it in the blood so that it can be excreted. But now in the blood, you have sensitivity and you react, and you have a bad reaction. Yeah. And they tell you, well, it's your body cleaning up, when they're actually triggering your autoimmunity. Yeah. So that's another issue, this hyper specialization. Like, I consider myself like we say, well, generalists is people that know nothing about everything. Yeah. And specialists are people that know everything about nothing. But I consider myself almost like an hyper generalist, being able to consider all those things and really, I know I'm not God, that I cannot handle everything, but just knowing that, okay, in that case, well, that could benefit. Yeah. I had a patient the other day, new patient, and he comes in and he has, when your spinal canal gets smaller, can you remember how you said that in English? And so a lot of his symptoms are relieved when he's like bending forward. And in chiropractic, one of my entry point is a lot about neurological tension and neurological things. And that guy, when I test him, when I put him in extension, everything gets worked, the way he functions, his pain. When he goes into flexion, bending forward, he's so much better. And like, I have a little bit of tension. I could justify treating him with my approach, but I know it's not going to be the best benefit. There's a colleague of mine, he does mechanical traction, Cox technique in flexion. And for me, that's ideal indication. I send him to this colleague, and the guy could barely walk 300 meters. After 2 weeks of care, yeah, he walks 5 kilometers. Yeah. And so really, I could have treated him a month with my approach and probably wouldn't have done much with him. Yeah. So it's really this idea of the more you know, the more you can take all this consideration, not necessarily that you're going to all be able to help everyone, but know that, okay, wow, in that case, I think that this therapy is best appropriate for that guy, whether it's me delivering it, great, or whether it's a colleague, or like in the case of Johan, I talked about another medical doctors that yes, we'll use drug, but drug for the cause of the problem, you know.
Yeah.
And I think that's the beauty of perspective.
Yeah. Yeah. And then it becomes integrative medicine on that scale, that you know how we collaborate with each other, and putting the patient needs in the focus for healing.
Yeah.
Yeah.
Yeah, which is, I mean, for me, probably this is probably the biggest obstacle, in a sense that, unfortunately, yes, there's a lot of people that went into medicine to help people, but there's also a lot of ego.
Yeah.
And sometimes when you want to work together, you know, communication and dealing with other professionals' ego, sometimes it's a big thing. But it's, yeah, for people that have complex issues, it's very important to have, you know, at least someone who leads and get things organized. Because very often what I find people is like, they want, you know, they want to, they go in so many directions, and then we get lost and we go nowhere. And
Yeah.
sometimes it's just a matter of, okay, let's stop here for a moment. Let's take a few steps back. I know that you try to want to go further, but man, we need to, you know, like these patients, like 30 supplements. Now she's on a detox protocol. And it's like, well, you know, and nothing has worked. And it's like, well, where's the clinical exam?
Yeah. Yeah.
Well, I haven't had any clinical exam. Well, I don't know if I'm going to be able to help you, but one thing I'm sure of is that as long as we don't have a clinical exam,
Yeah.
we're not going to go anywhere. We don't know the priorities. We don't know, you know, what's going on. So I think that those things here that we have, it's magic, and it gets lost, you know, at the on those times of ChatGPT now. You know, I saw an article in a newspaper the other day. This lady that went to, I don't know how many dozens of specialists in the States, and then she typed her child's symptoms in ChatGPT, and ChatGPT, you know, came up with a diagnosis, and she went to a specialist with it, and they confirmed that what it was.
Mm.
Great for her, but it's like, you know, that's always the extreme cases. So in those dates of technology, let's use technology, but let's use technology wisely. And I think the, you know, the clinical exam and the encounter, you know,
Yeah.
like I know I've been able to help people that haven't been helped by other colleagues just because of who I am, you know,
Exactly.
and my own levels of vibration, in a sense, because I didn't do much different than them. And I know there's some people that hasn't responded to me that has probably responded to other people that also did something probably similar because of who they are. So the match also, you know, it's like one of my mentor, Dr. John DeMartini, he used to repeat, you know, it's like, I mean, if you're more integrated than your patient, you can bring them up. You know, if you're if you're more disintegrated than them, they will bring them up, but they won't heal. So
Yeah.
it's also who you are really matters a lot. And you know, I think you've done some hurt math, right? Or at least
Yeah.
you've been
I was
interested in this
yeah. Yeah. Coherence.
feedback. And they have done, you know, this article, The Electricity of Touch, where they've shown that when you have two people interacting, like a doctor and a patient, you can actually pick up, you know, the EEG pattern of the doctor into the patient's cardiac system and vice versa, right? So if you come from a place of being centered and being loving and you know, sending this good vibe, in a sense, that will make wonders, you know. Or the developer of chiropractic, BJ Palmer, used to talk about the adjustment with that something extra. You know, it's like he was referring to these different levels of adjustments where, you know, if you deliver an adjustment to someone thinking about your golf game from the day before, it's going to be a totally different experience than if you're 100% present
Yeah.
and loving and just humbling yourself to, you know, a force that is way beyond us. That is totally different experience. So
Yes.
that's another added, you know, dimension that's very important, and also recognizes that sometimes, you know, the universe sends us patients not so that we can help them or cure them, but because they maybe we get too cocky, thinking now we're getting too good. So the universe sends us someone that we can help, just cannot help, just to bring back some balance into us, you know. So there's many different dimensions to the healing relationship, and someone, you know, people visit us, and they're our teachers also, you know. So without us and them knowing that, you know, the takes this dimension. So there's many dimension, and I think, you know, the key is really to still being curious. And I mean, the reason why we, you know, we don't see each other very often, but periodically, you know, our path crosses, is because we're still curious. You know, like I've been at it, what is it, soon it's going to be 25 years, and I'm still in that sense of almost doubt, you know. Sometimes, I mean, I have certainty about what I can bring, but at the same time I still have that thing, is like the impression I don't know anything, and I'm just starting, and that maybe one day I'll figure it out. So it's this curiosity and this humility. I think it's very, very important when you're looking for someone to care for you, that they're, especially if you have complex things, that they're humble, say, well, I for sure don't have all the answers, but I will search for them when needed. And for sure, at some point, because of the complexity of the system, we're going to make mistakes, and we're going to have maybe to take a step back. I mean, our approach, you know, it's not mistakes that are going to be costly to you. I mean, you know, if you operate on the wrong side of the body, that's something that you can go back, right? But it's like, you know, sometimes, and even sometimes, like we do something and it's not the response that we want, but just the response that we've gotten give us a new clue as to what is going on. So it's really this, you know, this idea of, yeah, you know, let's be humble. Things are difficult, even if when we talk about it theoretically, it sounds really, you know, well organized and easy. Things are complex, you know. There's so many dimensions, and we just do our best. So, you know, if you're looking for someone, there's hope, and just find someone that you resonate with. I think it's very important.
Yeah, so important, so well put. Yeah. So wrapping this up, for people that, you know, because there's going to be listeners from all over the place, not only in Sweden listening to this, for those that are curious finding out more about you, you have several web pages with really good information, I believe, still. Yeah. So how do
I don't know, you know, like I have so many things that, like, some of them I don't even remember they're online, and some of them are, we read things on in English for people, which is called the Unritalin Solution, but it dates from 2010. It's really updated. We haven't done anything for them. I have my YouTube, but it's like in French once a week. Probably, if I don't know where you put the information, but if you if someone really has a question, just send me an email. You know, you have my email. You can put my email there.
I'll put your email detail, yeah.
So because I mean, again, I could list you all the things I have, but I'm not sure it's really going to be helpful for people. It's just better for them to just send me an email if they have a question, and I can direct them to the resource if they're interested in knowing more.
Wonderful. Is there any last words you would like to wrap it up for the listeners?
No, thank you. I think you know, always appreciate the opportunity to be able to share you know, some of the things we do. So I really appreciate you inviting me, and I really appreciate people listening, because I know in today's, you know, environment, your attention and your time are very valuable. So I'm really appreciative of people taking the time. You know.
Thank you for taking the time to.
My pleasure.
To share your expertise and knowledge, because it's valuable, and more people needs to get to know it. That's my certainty. So for those listeners that have stayed all the way to this, listen to this, there will be details down to contact Yannick Palli. There are my details as well about Wellage in Old Town. You feel free to reach out to Yannick, to myself, with any questions, anything that you want to you like to have answers on, and we will do our best to assist you. So with that, thank you ever so
Absolutely.
much. Be well and have an edge. And I'll stop the recording here.